So we're joined from Atlanta, Georgia, by my friend, Dr. Bria Savage, owner of Savage Physical Therapy out there in Georgia. Thank you so much for taking some time for us today. I've got a room full here with me at Velma Jackson. This is our entrepreneurship class. We're recording this for all of our friends in Madison County schools, Madison Central, Germantown High School, Ridgeland High School, the Academic Options Center, and my good friend Mary Slaughter over at the Madison Career and Technical Center, teaching our health science students in Madison County schools. So thank you so much for taking some time for us today.
Thank you for having me, y'all.
Now, obviously, we want to talk about your really cool business because it is kind of a new thing in the world of physical therapy. But let's get a little background because you're originally from Monroe, Louisiana, went to UL
hmm
Monroe, and you hear people say, "I want to go to PT school. I want to be a physical therapist," and I don't think a lot of people understand what goes into that process. So tell us a little bit about your undergrad experience and then your PT school out in California, getting your doctor of physical therapy.
Okay, so yeah, I went to the University of Louisiana at Monroe, where I got my bachelor's in kinesiology, pre-physical therapy. And during that time, I completed a clinical rotation or internship at a physical therapy clinic in Monroe, Louisiana. And so, in order to get into PT school, you have to have so many hours of shadowing or interning to get into PT school. So, during my last year at ULM is when I was getting all of my shadowing hours and I applied for PT school. And PT school is definitely a different beast. It's very competitive to get into because class sizes range from 30 to 60 people, and they're getting thousands of applicants every year to get into PT school. And so I had to make sure my science and math GPA were on point, make sure they stayed up nice and high. I had to have good letters of recommendation. And then I had to have enough hours of shadowing in different settings. So they want you to have different settings as far as outpatient or inpatient, skilled nursing facilities, things like that to get your shadowing hours. And so I went to the University of St. Augustine for health sciences in Austin, Texas. So I went to the Austin campus for
Okay,
grad school.
gotcha.
They have multiple locations now, but I went to the Austin, Texas location, and that track was a little bit accelerated. So it took me about 2.5 years to get my doctorate in physical therapy. Usually you're looking at about 3 to 3.5 years to get your doctorate.
Yeah, and congratulations on that, by the way. But when
Thank
people
you.
look at physical therapy, we see the TV shows, we see the commercials, and all of that, and it looks like you're just helping people walk and helping people, with rehabilitating injuries, helping them rehab from surgery. And that is part of it, but you
Mhm.
have to be an expert on the human body and how it recovers from injuries and recovers from surgeries, and then there's a lot of documentation involved as well. So for people that want to be physical therapists, or even, physical therapy assistant is another great career that we have great programs here in Mississippi. What are some things
Yeah.
people need to know about physical therapy if they want to be in this field that they need to be skilled at?
Yeah, so physical therapy is a very like broad industry. There are different factors that go into it. So currently I'm in the sports performance and rehab side. So I work with a lot of athletes. These athletes don't necessarily have to be injured. Sometimes I'm just helping them move better, helping them get their mobility a little bit better so that they can get deeper into some certain like athletic positions. Right now, we're just finished our NFL combine training. So getting those guys prepared to go to Indy and compete there. I do see post op, so your ACL reconstructions and things like that. But outside of sports, there's your geriatrics, where you're going to be working with our older populations with like balance and helping them not fall. You have your pelvic health, where you're going to be working with men and women who may be dealing with incontinence or women after pregnancy. We have your outpatient ortho, which is your general injuries such as low back pain. People have been in motor vehicle accidents and things of that nature, your total knee replacements. And then you have your inpatient, where you can be working in a hospital with ICU, where you're going to be navigating a bunch of tubes, and your goal for the day is just to help somebody sit on the edge of the bed without
Yeah.
losing their oxygen. So it's so many things that go into the industry, but I would say the main things that you need to learn in order to be a physical therapist is to be adaptive, to be flexible, and to be you're good. To be adaptable, to be flexible, and to have great personal skills. bedside manners, being able to be empathetic with people, being able to talk to people. Because the thing is, a lot of people dealing with injuries, they're having to relearn a lot of things, and that's a big emotional toll on them. And so when you're working with them, yes, we're caring about their body, but we're also caring about their mind and their emotion, their mental. How are they really doing, and how are they coping? Because all of that goes into the rehab process.
Yeah, and when I talk about anything health science, I always remind people to get in this field, you have to be comfortable touching people, you have to be
Mm-hmm.
able smelling things, you have to be comfortable seeing things, seeing bodily fluids, because again, you got to be an expert on the human body, and the human body does a lot of funky things.
Absolutely. I must say, because I've been a PT going on 7 years now, and I've experienced being vomited on. I've experienced being pooped on and being peed on. And of course, they didn't do it on purpose. But those things happen. Blood, thankfully, blood hasn't touched me, but having to deal with packing wounds, somebody who has a
Yeah,
sacral ulcer from laying in bed,
yeah.
being able to go in and change that padding and being able to pack the wound with things that's going to help it heal. And yes, they don't always smell the best, but being able to push through those things without making the faces, because all you're going to do is make the person feel bad. They can't do anything about their sacral ulcer. And so they don't need you talking about, oh, it stinks so bad, or making those scrunchy up faces. Like, we all know in the room that it doesn't smell the best, but how can you still help that person feel like that they're a human versus just another, injury or body or wound?
Yeah, and it really can be such a rewarding career if you're really
Mm-hmm.
willing to put in the work and in it for the right reasons. But one thing I think is interesting, and I've had a couple people on this platform in similar positions, and all of them have
Mm-hmm.
said the same thing about, I'll give you a perfect example. On this same platform a couple years ago, we had a local doctor who was the
Mm-hmm.
only black female GI doctor in the state of Mississippi. And she had won all these awards in colorectal care, all these pediatric awards in colon care for children. And she decided, I want to work for myself. I want to open my own business. I want to have my own brand. And she said, I realized very quickly that I knew everything there was to know about the medical field, but I knew nothing about how to run a business. So it is a completely different skill because look, I think we can both agree there's a huge need for physical therapists at all of our healthcare facilities of all types. And it is a
Mm-hmm.
great career to get into as an employee, and you will have a lot of job security. But being an entrepreneur as a physical therapist is a completely different road to go down. So, talk about that because this is obviously our entrepreneurship class. And while we do encourage our kids that want to be health science professionals, we encourage everybody that
Mm-hmm.
wants to be an entrepreneur. And it really is something that I think young people don't understand what they're getting into.
Yes, so I would say that transition has been very eye-opening, but I'm very thankful that even when I was in high school, I got mentors who kind of gave me a little bit of a blueprint to help with that transition. Now, I have to admit, I am not full-time entrepreneur right now. I love still having the cushion of working with different businesses financially, but also with just the clientele. Like right now, I'm working with EXO Sports Performance for our NFL Combine and our NFL off season training. So that's been amazing. But I started Savage Physical Therapy, which is my business, back in 2020 when there was an
Wow.
NFL player back home who wanted some treatment. And in order to be legal to treat them, I'm like, okay, I have to actually get a business. And so I started off very small with just one or two clients a year while I still worked full time. And then as word of mouth grew, um, I was able to transition to do part time as being employed somewhere, and the other part time working all the way for myself. But it's way more into it, the marketing of it, the bookkeeping, knowing, your ROI, and all of those things come into play when you're starting a business. Like, it's not just treat somebody and make money. You have to make sure that you're fully legal. You have to have your malpractice insurance. So it's so many other things that go into it on the back end to make sure your treatment is going well. So yeah, it was definitely a huge transition, but I must say my transition was a little smoother with mentorship. So I always encourage people, like, no matter what stage you are in life, get a mentor, because
Yeah.
they're going to be able to help you avoid some of those blocks and stumbles that they had to go through. And I'd rather learn from them versus learning from experience.
Big time. Now, something that something you kind of mentioned there is you talked about you worked with certain clients. And I don't care what
Mhm.
type of business you open, you've got to have the mindset of, I need to do what the customer wants, not what I want. And especially in your case, because you talked
Absolutely.
about malpractice insurance, you have people's health, their life, their livelihood, if you're working with a professional
Mhm.
athlete, on the line. So you have to listen very closely to what their symptoms, to where their pain is, to what they want to improve. And that could be in any business. If you want to build somebody a house, you have to listen about what they want. This is somebody's shelter. So, talk about the listening aspect of being an entrepreneur in this field, because obviously you're an expert, but you have to listen to them because they're the expert on what's going on inside their body.
Absolutely. The listening aspect is huge because, of course, when you get into this field, it's still customer service, it's still customer care. So there's a level of autonomy, meaning the client or the patient still has some say in what they need or want to do with their bodies. On the flip side, with you having the clinical background and the doctorate in it, you need to be able to hear what they're saying, take your clinical reasoning, and combine the two. Now, of course, because we have a doctorate now, you have this due diligence that you got to make sure as you're listening, you're catching any and all red flags. Because if you miss anything, that could be somebody's life on the line. That could be somebody's limb on the line, like an amputation. So if you're not listening, you're going to be missing things. And if you miss things and someone dies or someone loses a limb or, an outcome happens that's not so favorable, that's your license on the line. So that's, your 6+ years of school going down the drain because you didn't listen effectively or efficiently. So listening is so big in this profession, especially with humans in particular. People want to feel heard. They want to feel seen. They want to feel like you care. If you don't listen, they feel like you don't care. And like the famous quote, people will remember not what you said, but how you made them feel. So if you make them feel like they're not being heard, they're not coming back to you. Before you know it, they're going to let somebody else know. Hey, she actually didn't listen. I went to an hour-long appointment and she did not listen, and you shouldn't go to her. And now there's the rest of your clientele. So yeah, it's super important to listen.
Yeah, and something that you do is so cool with Savage PT is it is 100% concierge. Now, explain what
Mhm.
concierge service is, because it is getting more and more kind of a trend for a lot of these healthcare industries. A lot of healthcare entrepreneurs are going toward the concierge aspect, and it can be very lucrative and very rewarding. So, talk a little bit about that, because it is not your typical come see me at the clinic.
Yes, so concierge, pretty much in a nutshell, I come to you. With my clientele in particular, I do work with a lot of professional athletes and I do work with some celebrities. And so a lot of times they don't want to come into a clinic. And so they pay me to pull up to their house to set up and to provide their services. So concierge literally means just I'm coming to you to provide the service. And it's been super fun, super rewarding. And they are paying a little bit extra, but it's for their convenience. It's for being able to be treated in their own home, in their own environments. So yeah, that's
Yeah,
how
and
it's been
that's
going.
something I always talk about. People will pay for convenience. And if you're able to
Mhm.
offer a little bit more than somebody else, people will pay a little bit more. And over time, that's going to add up. Now, before I get to their questions, you've mentioned something a couple of times that I think our kids have kind of, their ears have perked up a little bit. You've talked about you've
Mhm.
worked with professional athletes, you've worked with celebrities, but you
Mhm.
didn't just knock on their door and say, "Hey, I'm here." Because I talk all the time about networking and I talk all the time about marketing yourself, the importance
Mhm.
of being able to sell yourself, being able to walk in a room and introduce yourself to people confidently and say, here's why I'm qualified to help you. So obviously, there's always a little bit of luck involved, but at the same time, you've got to show that you are the best at it. So, how do you get these clients that everybody else wants to have?
Yeah. So one key word that you said was networking, relationships. That is more valuable than people think. Sometimes relationships will get you indoors that your credentials can't. So for a
There
lot
you
of
go.
the clients that I have gotten, it's because I was showing up in different places. I was being consistent. I was working for free, sometimes like volunteering at different tournaments. And then someone would notice me and say, who is she? She's been here every weekend. She looks like she's doing good work. And next thing you know, somebody's coming over to talk, hey, who are you? What are you doing? tell them, my name is Dr. Savage. This is what I do. This is what I can provide. And pretty much they say, okay, I'm gonna pass your name along. And a lot of times that's exactly how it happened. They pass my name along to someone else, pass it along to someone else, and then before you know it, I am getting these different clients. And so it was consistency of networking, developing genuine relationships, reaching out to people in places that I wanted to be. So I remember when I was first on this road to get to professional athletes, I was reaching out to directors of rehab at different colleges. And these guys at different colleges, they usually had players who went on to the league. So they would end up putting me in contact with someone else who put me in contact with somebody else. And before you know it, that's how those bridges were built. So relationships, I must say, have been like the key to me getting to where I am.
That's awesome. But I do have some
Yeah.
questions here. These are all really good. This first one is Albriana Towner. She's in 11th grade. And she
Mm-hmm.
asked, what changes have you made in your business since you've opened?
What changes? I have learned to evolve with the time. Social media more to market myself, whether it's using more technology within the field. But I've learned to be flexible and adapt to the times. Like the old methods don't always work. It's nice to have your traditions, it's nice to have your principles, but the vehicle that you get to the outcome can change. So your principles can stay the same, but you can change the vehicle that gets you there. And so I've learned, if the new technology is in, if it's proven scientifically and backed scientifically and it's safe, hey, I'll use that. If social media is king right now, then I might have to get more on social media and post a little more, do my story, show a little bit more on my a day in the life, things like that. So I must say my marketing, my outreach in that sense have changed.
That's awesome. This is Avery
Yeah.
Harris. She's in 10th grade, one of our volleyball players here, also a champion
Mhm.
archer. But she asked,
Right.
what's the biggest lesson you've learned from making a mistake as a business owner?
Ooh, one of the biggest lessons is that one failure, one mistake is not the end. I've learned that failures and mistakes are literally the stepping stones to, get to your next. So if you look at it as, it's a mistake, it's the end of the world. It's not. You can always come back from it. You can always learn from it. You can always be better from it. So I would say that's probably the biggest one. Not to sit and sulk in my mistakes or my failures, but to take it, glean from the process, glean what have I learned, what can I do differently, and then implement that the next time. And even like I say, get guidance, get mentorship on, okay, this is what I did, this is how I did it, this is how I failed at it. Now, this is what I'm trying to do. What's your thought? What's your advice on how to do better? So yeah, I would say that's probably the biggest
Love
one.
it. Now, I love this question here. This is Shateria Hannon. She's in 10th grade.
Mm-hmm.
And something that we've learned on this platform, and you just were another example of that, is most of these entrepreneurs are holding on to at least part-time jobs for obvious reasons. But
Mm-hmm.
she asked, is your goal to ever go 100% full-time, and when will you know it is the right time?
Yes, so my goal is to open a brick and mortar Savage Physical
Oh,
Therapy
cool.
that has performance, rehab, recovery, and research like
Oh,
all
that's
in
awesome.
one. So that is definitely the goal. I think right now, um, my short-term goals are more so building more credibility behind my name so that my name can go into rooms and kind of speak for me when I'm not in there, that they know my reputation and my character. So I'm making sure that is solid and it's getting in the right rooms. I'm definitely still building some cushion. So I think that process, I wouldn't say it's so time dependent. I think it's more so when things start lining up a little bit better, like getting approved at the bank for a line of credit so that I'm not like fully funding this out of pocket. So things like that. So I believe I'll know the time is right when I have a few more factors that are in line, like logistically.
Awesome. I like this one. This
Yeah.
is Zayden Mann. He's in 9th grade. And he asked, when you set out to be a physical therapist, was it always your goal to be an entrepreneur?
When I set out, not necessarily. My goal was to work for a pro team and kind of be set there. But I started off as a travel therapist, so I was able to travel to different cities and states and work for 3 to 6 months. And I fell in love with that, learning different cultures, learning different schools of thoughts. And so from that, I'm like, okay, now I do want to work for a pro team. But as I continue learning these different schools of thoughts and learning different people's blueprints, I realize like I can make this better and I can do it myself. So yes, I loved helping other people like build their businesses, but also I was gleaning from that, seeing what their mistakes and the shortcomings were so I could like build my own blueprint. So yeah, I I would say pro sports was always the goal, but having the autonomy to treat how I like to treat and to build a business and promote a standard of care, it's been great being an entrepreneur in that sense. Yeah,
Yeah, and
way more creativity.
one thing to mention about pro sports
Mhm.
is it can be very volatile, just like it is for the players. If a team has an ownership change and that general manager wants to bring in their own medical staff, that happens all the
They're
time. So
cleaning house.
even if you are something that someone that these players know and trust, if that general manager wants his people there or her people, that's who they're going to bring in. So it is a very
Mhm.
volatile, cutthroat uh, spot to get into.
Absolutely, absolutely. I have had so many friends who did work in the league who new coach, new management, and they're clearing house. They had the best of the best credentials, and they were still let go because they weren't conducive to the new culture of the team or new culture that that management was creating. And so, as an entrepreneur, I love the fact that I could create my own culture, my own atmosphere, and
That's
kind of
awesome.
set that rhythm.
Love it. All right, I got time for two more. This is Kaylin Bullock. She's in ninth
Mhm.
grade, and she asked if I wanted to be a physical therapist, what advice would you give me?
I would say go shadow a physical therapist, and you're never too young to do that. I did it my senior year of high school during spring break. I dedicated my spring break to shadowing a PT to see if that was truly what I
Wow.
wanted to do. And so I would say go and shadow a physical therapist, see what it feels like, make sure that's truly what you want to do because a it's a grind and it takes dedication. And you don't want to go to school all those years and realize, you know what, I actually don't like this. So go shadow a PT, research the different fields, the different industries within PT, and then from there, get after it. Start looking at different PT schools and seeing what do you need to get into there so that during your undergrad time, you make sure you're taking the right prerequisites, the right electives, so you're not wasting time and wasting credits, making sure you're taking those core electives, core credits, so that when it's time to apply for PT school, you don't have to take a bunch of extra classes as the prerequisites. So yeah, shadow, start researching these schools, and then for your undergrad, choose a degree that best puts you in line for PT school, like biology, kinesiology, even some psych. But you don't want to do something that you have to take a bunch of additional credits to do, because then that's just going to add more time with you being in school and more money.
Yeah, and one of our alums here at Velma Jackson just finished his PT program up at UT Southwestern in Memphis. So we're really proud of
Oh,
him.
nice.
And yeah, and he spent a year working as a PT tech to learn. That was his shadowing. He took a year off to
Mm-hmm.
learn the business and got hands-on with patients to see how the field worked. And he just finished, and we're really proud of him. I got one more.
Yeah.
This is Raheem Cole. He's in ninth grade, and he asked, "As young people start becoming future entrepreneurs, what skill is going to be the most important?"
What skill is going to be the most important is, and I don't know if this is the right term, but people skills. Like you, in a world that AI is taking over, and especially with being in entrepreneurship, you have to deal with people. You still need to be able to talk to people. You still need to be able to empathize with people, hold a conversation. Because when it's time to go in to ask for investments, they're not talking to a robot, they're talking to you. And people who invest in you, they want a narrative, they want a real story. They don't want an AI generated narrative. They want to hear your personal story, they want to hear the passion behind it. And it's hard for AI to do that. So you still need conversational skills. You still need to be able to talk to people versus put your thoughts in chat GPT so it can create a script for you. No, you still need to be able to talk to people. They need to feel the passion behind what you're saying.
Love it. Well, we're almost out of time, and we thank you so much for joining us. But a couple things before we go. First of all,
Mm-hmm.
savagephysicaltherapy.com is the website. Really
Mm-hmm.
cool. I think it's a very well put together website. All your services on there for anybody interested in how concierge physical therapy works. That's where they can find that. Now, the
Yes.
last thing before we go, something I think, and we just got through celebrating Black History Month, but something that
Hmm.
can't be talked about enough is, so many kids think if they can't play sports, that they can't be involved in it. We need
Hmm.
more Black kids to get in the medical side of sports. We need more Black physical therapists. We need more Black occupational therapists. We need more Black physical therapy assistants. These athletic trainers, all these people that are working with the athletes, they can look like the athletes too. And I think that's something that
Absolutely.
gets glossed over way too much, and people don't want to have that conversation. So as these kids are starting to make decisions, I mean, obviously, we talk about all the time, we need more Black-owned businesses, period. It's great for our
Mhm.
culture, it's great for our economy, and it's great for our communities. But we need more young Black kids to get into the health science entrepreneurship. There's not a lot, and there's not enough. You're one of very few. And we actually had another one on this platform that's a physical therapist who now is teaching here in Jackson. But it is something that
Nice.
really needs to happen in across all health science areas, but especially physical therapy. So as these kids are starting to make decisions after high school, why should they really consider this particular avenue of entrepreneurship?
So I would say, for one, the stats show that there's out of all the PTs in the world, 4% are Black.
Wow.
Only 4%.
Wow.
And so that shows you that there is a missing link in, helping kids find careers from childhood up through, college. Um, I know from my personal experiences being a young Black clinician that there's a level of comfortability and a level of trust that my clients have with me, especially those that are of color. Um, there's a level of trust that they know I take their pain seriously. They know that I take what they're telling me seriously, and we can get some stuff accomplished and get it done. So it's so important because I am a firm believer if you can see it, you can be it. And so if we can increase that number for the next generation that's coming through, we can increase that percentage from 4% to 10%, hopefully in
Love it.
the next few years. So yes, I definitely agree that there should be way more African Americans in this space for us to be role models for the next generation, for us to gain client trust and buy-in, and to boost the economy 100%.
Love it. Well, we thank you so much for fitting this in your schedule. I'm glad we finally got to have you on here. I know you've been really busy, but it's been an
Yeah.
absolute pleasure. Really cool business, one of the coolest ones we've had. But again, we thank you, Dr. Bria Savage, Savage Physical Therapy, all the way from Atlanta. Thank you so much for taking some time for us today.
Thank y'all so much for having me. I really appreciate it. I enjoyed chatting with y'all.
All right, talk to you soon.
All righty.